What's going on, everyone? Happy Tuesday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, or a test for some other virus, I hope you have tested negative. If you did test positive for any of the viruses, I hope you have a full and speedy recovery with no long-term and no long COVID issues. It is time now for the Tuesday edition of the Virus Update for Tuesday, February 11th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update. What's the virus update, you might ask? Well, you watch the local news, don't you? Most people do. And you see a local news where they give you the news headlines, the weather, sports, maybe a brief 30 seconds of health. What do we give you? We give you 15 to even as high as 25 minutes worth of coverage with all the news, data, and everything else in between on all these viruses that can make us sick. Not just here in the United States, but all around the world. I'm trying to include more things from other places around the world. What's the reasoning for this? To keep you safe and informed of what's going on. Things are constantly changing with these viruses. It has been a very, very busy, I might even want to just say sick winter, because there have been so many people sick this winter, and that is raging on right now. So I want to stay informed of what's going on. Subscribe down below. Help me to reach my journey to 10,000 subscribers by the end of this year. Give this video a thumbs up. Hit that notification bell. And, of course, share this video with anyone you know. Alrighty, it is a very busy day today. We have a lot of things to take a look at. News stories, some things I have pulled up. And we also have some data that's come in. And I'm telling you right now, you'll want to stick around. Some of this data is really bad today when it comes to flu. Flu is, I've been doing this channel for several years now. Since I started this channel, I've never seen flu get this bad before. So let's get right into it, shall we? In Indiana at Walhalla Beach, there is a bird flu outbreak suspected after 40 dead ducks have washed ashore. Yes, yet again. Remember last week we saw something similar to this in Chicago where there were a bunch of dead ducks or geese? Yeah, yet again we are finding this, and you guessed it, H5N1 is the problem this go around. It's so sad to see so much wildlife dying of this bird flu, which is really bad. In Pennsylvania, masks are being required once again at UPMC hospitals and outpatient areas starting on February 12th. And let me tell you something, being from Pennsylvania, I happen to know that's several hospitals, so that's good, but I wish it was all hospitals. I put a tweet out last night that masking should be mandatory in all healthcare. It really should be. Say what you want. If you wear a high-quality mask, it does work. There's enough studies out there that say, hey, it does work. All right, in Northeast Ohio, going just a little bit west, UPMC, they're out near Pittsburgh area, but they also have hospitals in other parts of Pennsylvania, central Pennsylvania included. Well, now we're going to move a little more west to Northeast Ohio, and this is coming from David Christopher over on X. Influenza A is crushing Ohio hospitals. PCR numbers skyrocketing week after week, closing in on 40% positivity, 3 times the peak of last winter. It's hitting people of all ages really hard. He says his hospital is a plague ward. Be safe, my friends. Wow, 40%. And you're going to see another number in a little bit that is very similar when it comes to being very high. All right, now we move on to this. This is Jonesboro, Arkansas. The spread of illness shuts down small businesses. Yes, there's so many people sick that it's shutting down small businesses. And one of those happened to be a restaurant. I believe it was called Gina's Place. And they're so short on staff, they have to shut down. So their daily customers that come can't come because they've had to close because so many people are out sick. All right, this is coming from Dr. Ding, Eric Ding, on X, and it says influenza reaches epidemic threshold in New York. Influenza A, unknown variety, the subtype, we don't know. They are checking for H5N1. Let's fingers crossed that's not it. But positivity soars yellow while hospitalizations and stand higher than past 3 years. The rise of unknown subtyping flu A has led New York to issue new alert to subtype all flu A immediately for bird flu. This is really concerning, and in just a few minutes, we're going to be taking a ride down the New Jersey Turnpike to another city which is doing really bad. If you know where I'm from, you know what city that is. Yeah, this is getting really serious. In New Hampshire, a resident contracts Mpox. Health officials say risk to public remains low. So, that is not a good thing. All right, moving on to this now. Now, we're going nationally. We just talked about the Northeast quite a bit, and we'll do it a little bit more later. But we're going nationally for a moment here, and this is not good. Google Trends data, you can go to their website, and matter of fact, let's click on it here. This is probably an easier way to show this. You can go to Google Trends, and you can click on the search data. You can actually check out how much activity is, how much interest there is in a typical or a different type of thing that people are searching. That's the word I was trying to look for, or the words I was trying to look for. And I said, let's go to Google Trends and type in Influenza A and see how much interest there is. And here's interest over time. I had to zoom this out all the way to when it began in 2004. Take a look at this. Interest in Influenza A. It is now projected that it is hitting the highest it has ever hit for Google. Ever. 2022 was the only time higher. And we can see here, even without this unfinished data, it's still really high. 2022, again, being the last time it has gotten that high. Take a look at this. If you do a simple search in Google Trends for the term sick, you will see, since data started in 2004, interest each year has peaked higher and higher in the U.S. This winter is the highest ever for interest in Google search sick. Not a good trend. Look at that. That is just absolutely insanity how high it has gone. It's gone to pretty much off the charts. So clearly there is something that is going on. All right, in the UK, I promised I would mention this today. There is a MERS case that is being reported. MERS coronavirus case. Just one new case being added. So that's rather interesting. And it's also interesting, the UK also lists here all the different virus cases that they're seeing of the different viruses. Now, as we all know, you and I both know, people don't always get tested for what they're sick for. So they could be missing things. Taking a look at New Zealand COVID-19 cases. And it says here the new case average is 78. The updated average from rats is 66. And it says your cases in hospital as of midnight Sunday, this past Sunday, 67. Total deaths attributed to COVID in New Zealand is 4,562. And here's the current situation. New cases reported, 644. Reinfections, 423. Reinfections last 90 or under 90 days, 5. I don't know what that actually means. 5. And then reinfections total comes up as 416,074. And cases reported total, 2,717,929. And who remembers, I'm going to do this, who remembers when New Zealand was so strict they would not allow visitors in from other countries? They had a COVID zero policy where they had a level 1 risk, level 2, level 3, and so on. I do, and now they've let it rip. Let the economy flourish, and here's what's happened. People have been infected. I get it. We couldn't close forever. We couldn't do all that stuff forever. I totally get it, but there had to be a better way of going about this where we could prevent infections. Like clean air, not just in New Zealand, all around the world. Clean air should be mandatory in all large facilities, all businesses. And masking should be a thing. I think it should be more encouraged. It shouldn't be mandatory everywhere except for healthcare. Healthcare definitely should be mandatory. I think it should be encouraged more. And I think people should have access to the studies that show, hey, masking does work. Now, I get it. There's other studies that say, it doesn't work. There's more studies that say it works than does not work. And you want to see some of those studies? You can go over to my website, datareport.info. Right there. Click on masking studies and you will see an archive of threads with links to studies that show masking does work. All right, moving on to the viral activity levels in Canada. COVID-19 is moderate. Flu A is high. Flu B is moderate. And the RSV level is still high at this time. RSV has been high up there for a good amount of time now. taking a look at what is going on in Pinellas County, Florida. And wow, we have a lot of things going on. Chest pain, stroke, unknown problem, cardiac arrest. And you know what? Elapsed time at the hospital, 22 minutes for a cardiac arrest call. That is not good. Oh, no, 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 no. That is really bad because cardiac arrest is the cream of the crop when it comes to calls for ambulances. And sometimes they have to call multiple personnel to come out for that. And now they're sitting at the hospital. Oh, yikes, not good. Sick person, allergic reaction. Sick person again, OD. You get the idea. It's busy down there. It's also busy up here in Pennsylvania, in Philadelphia. Matter of fact, yesterday was really busy. And there's a few reasons for this. Take a look at this number. 909 EMS calls for Monday. Now, I'm going to give you two potential reasons. One, the celebrations from the Super Bowl did not end until after midnight. Could have been a lot of calls from that. Two, influenza calls in the city of Philadelphia, or influenza cases, positivity rates, and emergency department visits have absolutely skyrocketed in this city. I can actually prove it to you. Take a look at this. This is really bad. I said we're going to take a ride down the New Jersey Turnpike, and we can see here, over 1,000 cases were reported in the last week for flu. Check this out. The positivity rate is now approaching, or if not over, 35% in Philadelphia for flu A. Flu B is not that high, but influenza A is exploding. Look at emergency department visits with people showing up to the emergency department and getting diagnosed with flu A. It is almost approaching 1,000. It is literally going straight upward. And I don't believe this factors in all those people that took out to the streets. I showed you a picture of that yesterday. And we're going to have 1 million plus people show up, crowded together for a Super Bowl parade on Sunday. Why would this suddenly go down? I mean, this is crazy. Not to mention that there's all the other viruses, but flu A is clearly the worst in the city of Philadelphia right now. Taking a look at what's going on just outside the city, and we do see, yikes, second day in a row we've looked at Montgomery County, and there's a cardiac arrest call. Collegeville right now is seeing a cardiac arrest call. A few other things. Chester County has been getting hit hard all afternoon. I hope that has finally changed, and there are less calls now. We'll see if this does decide to load. And there we go, it does. A little better than what it was earlier. There was actually a scroll bar within earlier, so it's a little bit better, but still, there's a lot of calls out there, and it looks like they're even being called out to Lancaster County, Pennsylvania, for a sick person. Hospitals in Pennsylvania, they are getting slammed today in the eastern, but the ones that are reporting. See, there's a ton of yellow here. New Jersey, we're seeing more yellow today. A lot of patient volume issues. What is going on at Virtua Our Lady of Lourdes Hospital in Canada? 70 patients in the emergency department with 22 in the waiting room. Oh my. Yeah, the things are really big. This is just week after week. We're now up to February 11th, and someone's going to say, well, as you know, flu season usually goes through March and sometimes April. Okay, it does, but usually we are on the backside of it now. It's starting to go down. Sometimes it goes up a little bit again early in the spring, but this is just a constant wave. I mean, it's just a constant throwing people at the emergency department. I mean, they're just constantly getting slammed is what I'm trying to say. This is really bad, folks. And no, I'm not trying to be a fearmonger. I'm showing you real, hardcore data evidence that shows things are really bad right now. Pennsylvania did update for wastewater today. Influenza A in the state of Pennsylvania continues to go up. You can see there are very high levels. I don't understand why Philadelphia is not included on this map. Just outside the city is Philadelphia. I would love to see what it is in wastewater for flu A. It's got to be like way up right now, just based on what we saw. Taking a look at what's going on with COVID in Pennsylvania, we do see here, southeast Pennsylvania, there are still some high levels. And then we have a lot of places that are moderate, and western Pennsylvania is actually improving to some lower levels now as well. So that is some good news. There's also some more data we can look at from Pennsylvania, but honestly, we'll save that for another day. Taking a look at the positivity rate from Walgreens, let me refresh this. I hope it loads today. Earlier, I was having problems once again. Nationally, 10.2% COVID positivity rate. Let's take a look at a few individual states, shall we? There we go. Washington State, 12.2% positivity rate for COVID. Testing only dropped by 2. You don't do enough testing, to be honest. That's positivity rate went up by 3.5%. Oregon, the positivity rate was nothing last week. It didn't update. 4.3% this week. California, the positivity rate is 9.9%. In Idaho, the positivity rate is 14.3%. The prior week is 4.8%. That's up by 9.5%. 14 versus 21 test. In Utah, the positivity rate is 2.5%. That's a difference of up 2.5% because it did not report last week. In Texas, Texas is still doing quite a bit of testing. 9.5% positivity rate. The prior week was 8.6%. That's up by 1%. Total tests, 2,105 versus 2,267. So testing did drop some. Arkansas, the positivity rate is 9%. The prior week was 7.5%. Difference of up 1.5%. Total tests, 222 versus 227. Taking a look at Indiana. Indiana, the positivity rate is 14%. That's down by 2.2%. Testing did go up slightly. Taking a look at Georgia, the positivity rate is 9% versus 7.1%. That's a difference of up 1.9%. Total tests, 378 versus 480. Missouri, the positivity rate is 9.8%. The prior week was 7.9%. That's a difference of up 1.9%. And that's with testing going up a good amount. 346 tests versus 241. Alrighty, let's take a look at a few wastewater sites. And I do want to express caution here. A lot of wonky movements today on wastewater scan. And we can see here nationwide. Yeah, take a look at that. You can see it started going up and then it just wonkily went down. Not making much sense as to why it's doing that for COVID. But nonetheless, we'll take a look at a few wastewater sites. And I suggest that we should take a look at the West Coast because we just talked about so much in the East and still got New York to come. So let's take a look at some stuff on the West Coast. San Diego, California. We can see here COVID is flat. RSV is rising slightly. Mind you, the levels are not calculated here. Influenza A is flat. Influenza B is rising at this time. HMPV, not really calculated, and it is low at this time. And everything else is fine. A couple detections of hepatitis A at this time. Let's make our way up to LA, and let's see what's going on. Let's go to the north west side of LA. We can see here that COVID levels are low. RSV is still listed high. It's dropping. Influenza A is not really rising at this point. Influenza B is still listed at high. And HMPV is low at this time. EVD 6.8 low. Norovirus is in the medium category at this time. And I don't know why there are so many hepatitis detections. If that was true, that is just really, really bad. I'm hoping that is not true. All right, let's move on here to the CDC page. And, well, first off, take a look at this. XEC is the COVID variant that is dominating at this time in the United States at 43%. LP 8.1 then comes next at 20%. That's the one that does have a potential to take over. You can see here on this chart that if you look at the orange, it's increasing. And a lot of people suggest that could be the next variant that takes over. What will happen while that takes over? Well, that remains to be seen. All right, let's take a look at influenza A in a few states here and see what's going on. Let's go to California first. And yeah, take a look at this. Influenza A in wastewater here in California. Really bad. I mean, look at all these different wastewater sites. And you can see it is listed at very high in California. And we can see here, it was starting to go down, then it just gone up again, and it's back in the very high category. Let's go up to Washington State. We'll do Washington and Oregon as well, and then we will move on to New York City, or New York State, and take a look here. Yeah, Washington, Seattle area is getting hit very hard with flu at this time. Very high levels, and we can see here, it has literally gone straight up. Compare that to the national level. Yeah, it is, I mean, it is off the charts very high in Washington. Now going over to Oregon, shall we? Let's see what's going on there. And we can see Oregon, no data. I wish there was. So in light of that, let's go to Arizona, shall we? We'll just do another state out on the West Coast. And in Arizona, we do see flu is listed at moderate at this time. And it's just started going back up. And you know what? I'm feeling very friendly. Let's do Nevada as well. Got to give some more respect to the West Coast. Now, Nevada only has one wastewater site. And that one wastewater site is listed at high at this time. Alrighty, we got to pause for a moment. You need to take a hydration break. I need to take a hydration break. I forget to do this sometimes in the video. Today, I'm not going to forget. Today's drink of choice is water. Make sure you stay hydrated, especially if you're sick. If you're someone that just needs to drink a lot of water, water is good for you. So stay hydrated. Let's take that break right now. Alrighty, doesn't that feel much better? You know, the water going down your throat. It's very important that you stay hydrated. Alrighty, moving on now. Let's move on to what is going on in New York State, shall we? New York State reported 843 new cases today, and we can see here those cases, while they don't look like they're going in any direction at this point. They look like maybe they're going up slightly still, but really they're just bouncing around. What we are not seeing, and the point I'm trying to get across is, let's change this. Let's do something we don't normally do, but I want to show you 24 months. Can we do that? Will that come across? Take a look here. Here's 24 months. And usually what we would see after the holidays, and you know what? We got to go out a little bit further than this. Let's go 16 months. Usually what we would see after the holidays, haha, this shows exactly what I want to show. Look how it usually goes straight down. Well, what we're seeing right now is not straight down in New York State. It's much more similar to what we saw in the summertime, isn't it? Where it's going up, it's going straight across, and it's like a little wavy a little bit. So I honestly can't tell you when this actually is going to go down, like what we would see in other years. So while it didn't get as high, the period of time that's a higher risk is more extended because cases, they're not really going down. They're just going, waving its way straight across. Hospitalizations. Over a period of time from the holidays, yes, they have gone down. But they're not going straight down. I can do the same thing we just did before. Let's zoom this out to 25 months, we'll just say. And you can see here, normally it would go down pretty quickly after a wave. This time, it's not doing that. And today's hospitalizations are 843 people in the hospital, 70 people in the ICU. And when we take a look at hospital admissions, we can see here, they're not really going down all that fast either. They are over time. The overall trend is downward, but it's not a rapid one. And quite frankly, to be honest, I got to show you New York City. New York City, yeah, that's not really going down. Hospital admissions there? No. They've been steadily climbing the ladder. And the same thing with hospitalizations. Hospitalizations may finally be getting ready to drop there, but you can see here, it is not doing, and I'm going to zoom this out once again. We'll just go above 25, 27 months. How about that? You can see here, normally it would go up and go down. Each wave normally would go up and go down, go up and go down. Well, guess what? We haven't even gotten to the part where it's going down yet. It's more so, remember what the cases were doing, more so just slowly going up. Maybe it's going to start going down now. I hope it is. Alrighty, folks, that does it for the Tuesday edition of the Virus Update. I hope you learned something today, and if you did, I hope it is that, hey, flu is really bad out there. COVID, it's still out there too. COVID is not going away. We really need some answers. We need some answers as to why flu is just so darn bad this year. Could it be everyone's immune system's getting messed up from COVID? Could it be there's something else going on? Could we start seeing more human H5N1 cases soon? I honestly don't know, but we need some answers soon because this is really concerning how high the flu levels are going. It's not just Philadelphia. It's not just New York. You saw California. The West Coast is getting hit just as hard. You saw that wastewater. It is off the charts bad for flu this year. And all ages are getting hit hard with not just minor cases. All ages are having severe cases. Now, not every person's having a severe cases, but the point is, at any age, are we seeing severe cases pop up? Not good. If you enjoyed this video, give it a thumbs up. Subscribe down below. Help me get to 10,000 subscribers this year. Hit that notification bell. Share this video with anyone you know. And, of course, leave your comments down below. I'll see you all again tomorrow. I may see you twice tomorrow. I might do a short tomorrow morning. It's injection day for me tomorrow for my Exolar. No, I'm not getting another booster tomorrow. It's my asthma injection for Exolar. So the person who was about to type, oh, go take your boosters. No, that's not what I'm getting tomorrow. I get a monthly injection for asthma. And yes, it does help me. I'll see you all again tomorrow. Until I see you again tomorrow. Stay safe, everyone, and have a fantastic Tuesday afternoon. Thanks for watching.